Hi, I'm Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips for diaper rash. Diaper rash is a very common condition in babies who wear diapers, and it can be easily treated. Tip number one is to breastfeed your baby. Babies should be exclusively breastfed meaning breast milk is the only thing they need, up to 6 months of life. Babies who are breastfed are less likely to develop diaper rash. This has been shown in studies, and it's most likely because the characteristic of stool of babies who are breastfed is less irritating to the baby's skin than the characteristics of stool of babies who are fed formula. So tip number one is for many reasons, including for preventing diaper rash, breastfeed your baby feed your baby only with breast milk up to 6 months of life. Tip number two. Tip number two is to change your baby's diaper frequently to prevent diaper rash. You should check your baby's diaper about every 2 to 3 hours and change it if it's wet. Also, if your baby has a bowel movement, you should change your baby's diaper right after the bowel movement. Tip number three. The third tip for preventing diaper rash is to keep your baby's bottom clean. Once you take off the diaper, when you're changing the baby's diaper, take off the diaper. You can wash the baby's diaper area with a warm, wet washcloth, and it's optional. Optionally, you can also use a mild soap such as fragrance-free Dove or Cetaphil cleanser, but it's not necessary. You should pat the baby's bottom dry with a dry towel, and many people do use baby wipes instead of using a washcloth. If you do use baby wipes, make sure that they're fragrance-free and alcohol-free baby wipes, and try to avoid overusing baby wipes because they can lead to irritation. Tip number four, to prevent diaper rash, make sure try to allow your baby to have some diaper-free time. Diaper-free time will help your baby's skin dry out the reason why you want your baby's skin to dry out is that it's less likely to get irritated when you put a new diaper on. So this is not only a good way, having your baby have some diaper-free time is not only a good way to prevent diaper rash, but it's also important when your baby develops a rash and you're trying to treat it. Tip number five, to prevent diaper rash, use a topical barrier. There are many popular over-the-counter choices, including Desitin, triple paste, A&D ointment, or Balmex. Also, white petrolatum by Vaseline is an inexpensive alternative. Apply these barrier ointments after each diaper change. So what you're going to do, you'll check your baby's diaper every 2 to 3 hours. If it's wet or your baby has a bowel movement, you'll change the diaper. You can wash the baby's bottom with warm soap, and if you want to, with warm water, and you can add soap if you desire. Let the baby's bottom air out if possible by letting your baby go diaper free for a few minutes, or by patting the baby's skin dry with a dry cloth. Then, before you put the diaper on, add one of these topical barrier ointments, the Desitin triple paste, A&D ointment, Balmex, or for the inexpensive alternative, white petrolatum by Vaseline. Then you apply the diaper. So those are our first 5 tips. Those were for preventing diaper rash. They were breastfeeding your baby breast milk only up to 6 months of life, doing frequent diaper changes, keeping your baby's bottom clean with warm water, and you can add soap if desired, letting your baby have some diaper-free time, using a topical barrier ointment before you apply the next diaper. Tip number 6, if your baby does develop a diaper rash, then switch to disposable diapers if you're using cloth diapers, and continue to use disposable diapers if you already are using them. It hasn't been proven that disposable diapers are better than cloth diapers to prevent diaper rash, but once your baby does develop diaper rash, because disposable diapers are more absorbent of moisture, they're better than cloth diapers for treating a diaper rash. Also, you should know when to see a doctor. That's tip number 7. If the rash has gotten worse despite doing all of the good things that I've described so far, or it hasn't gotten better after 3 days of treatment, or your baby develops diarrhea, or your baby develops a temperature, which is a fever, which is a temperature of 100.4 Fahrenheit or 38 degrees Celsius, then you should bring your baby in to be seen by the doctor. And tip number 8 is what your doctor may consider an antifungal agent. So antifungal agents are recommended when your baby develops, when your baby has a diaper rash that looks like it has a yeast infection on top of it. So the diaper rash, yeast causes a diaper rash that looks red, beefy, and like plaques. There are satellite plaques, meaning there are spots of the redness on the legs and the stomach, and the rash is usually inside the skin folds. Whereas if there isn't candida, usually the skin folds are not affected. Also, treatment for candida rash is recommended if your baby's rash has gone on for more than 3 days. If your doctor does prescribe an antifungal agent, then it should be used 3 times a day until the rash has resolved. And you should continue to use the barrier ointment that's recommended to prevent diaper rash, but put this on after you've put on the antifungal. So the barrier ointment, or the Desitin, triple paste, A&D ointment, Balmex, or white petrolatum Vaseline, goes on after the antifungal goes on. And tip number 9 is a topical corticosteroid. Topical corticosteroids, for instance, hydrocortisone 1%. It's a mild over-the-counter steroid ointment, and it may be recommended by your doctor if your baby's skin is severely inflamed, if it's very red. It's used, again, before you put on the barrier ointment, and it's applied twice a day for no more than 1 week. So, quick review: you can prevent diaper rash by breastfeeding your baby, frequently changing the diaper every 2 to 3 hours if your baby's diaper is wet, if your baby's diaper is wet, and immediately after your baby has a bowel movement. Washing your baby's bottom with a warm water washcloth, or a non-alcohol, non-fragrant, no fragrant or fragrance-free baby wipe. Applying a dry towel to pat it dry afterwards, letting your baby have some diaper-free time before you put on the next diaper. Using a topical barrier ointment such as Desitin, triple paste, A&D ointment, Balmex, wet petrolatum by Vaseline before you put on the next diaper. Once your baby develops a diaper rash, using disposable diapers, knowing when to see a doctor, considering an antifungal agent with the help of your doctor for treating fungal infection, and considering, lastly, a steroid ointment for no more than a week to help with severe inflammation. Tip number 10 is to believe in yourself. Diaper rash is extremely common, and what I've presented are some effective ways for preventing and treating it. I hope these tips have been helpful. Thank you very much for listening, and have a great day.